Mohammed. Welcome everyone for tonight webinar. As you see, tonight we are talking about the Saudi Arabia Choosing Wisely campaign. And the concept behind this, first, do no harm. I'm AlSaghier. I'm a family physician and home health care physician. I'm the advisor of Family Medicine Academies in Saudi Commission for Health Specialty, and I'm the physician lead of Choosing Wisely campaign in Ministry of Health. And I'm so happy that I'm introducing this concept tonight for family medicine resident trainers and training. Before I start, I just want to remind all of us that we had before heard about, and we also had, يعني كلنا قسمنا بأنه at least we will keep the patient, not to harm patients. First, do no harm, and this is one of Hippocrates concepts for the medical or the medicine. Okay, the objective of the webinar tonight is to define the Choosing Wisely campaign. What is Choosing Wisely? Recognize the harm associated with overuse, the areas in which there is an overuse, and had an examples of the overuse and the concept of this, and the Choosing Wisely, Saudi Choosing Wisely campaign. First of all, I will start with this patient. We will have a small interactive question part of this case. This is a 37-year-old male who has been experiencing frequent low back pain for 3 weeks. No history of trauma. His neurological examination is normal, and the decision was to refer him for physiotherapy, but they requested a lumbar spine radiology for this patient before they start the session. What do you think? What you would do? Back X-ray, CT, spine, MRI. Sarah, if you put the polling questions, or none of the above. We have a question I want you to answer now. Sarah, did you add it in the chat? إذا تختاروا الإجابات, just choose the questions, the answer. Which one? What you would do for this patient? X-ray, CT, MRI, none of the above. Till now, 11 has answered. 12.
الأغلب the last choice دكتورة.
يجاوبوا 13 totally, صح؟
Yes.
Till now. Okay. يعني الأغلبية قال none of the above. Okay. Let's go to the next case. We had a 17 years old lady, a female, and I just want to take this polling from, has been experiencing a frequent headache for the past week. Her history is remarkable for migraine. Historically, she had it's occurring 1 to 2 times per year. Neurological exam is normal. Her mother is worried that she might have multiple sclerosis or a brain tumor, and is requesting a CT brain or MRI. What do you think? Mother is insisting. Are you going to request the CT brain with contrast, MRI, or none of the above? 15 جاوبوا إلى الآن.
الأغلب نفس اللي قبل شوي. نعم.
نعم في هذا. طيب. It has been shown إنه radiological procedure has a harm. An exposure of radiation, as you see here, it was very clear. This dot shows how many the exposure and how much we are exposed in radiation when we are requesting X-ray lumbar spine or CT, X-ray lumbar spine, CT lumbar, and how much is the exposure, CT with contracts, and just think many times before exposing the patient this harm. As shown here, that the radiation exposure is higher, so much higher. And when we compare it with an X-ray, when we go to the CT scan is 100 times as an X-ray. CT abdomen is higher. Lumbar spine is higher than the chest X-ray. Skull is also there. So exposing the patient to radiation is there. What's the harm of imaging for low back pain? Lumbar radiation, CT, contribute to cumulative radiation exposure, and this could promote carcinogenesis. It has been shown that there is an additional 1,200 additional cases of cancer because of radiation, one additional case of cancer for ladies, because we are exposing them to radiation at a higher level, as if it's similar, and this radiation dose similar to the lumbar spine CT. Usually when we go younger, the risk is double. Imaging for back pain has no psychological benefit to the patient. There could be an abnormality detected, which is common in asymptomatic patients, and this is higher when we go ager, and the age 60 or older. There will we will find some finding. 36% had herniated disc, 21 had spinal stenosis, 90 had degenerative disc there. Presence of imaging abnormality did not mean abnormalities are responsible for symptoms. If you see this MRI, it is shown very clearly here that there is a herniation. This is for the patient 6 months later. This is the spine and the herniation is done. What has been done here? Nothing. This is a lady, nothing was being done. The the MRI was done. This herniation was there, and this was an incidentaloma, and 6 months later, it is completely normal. So there is a harm of imaging. Those who receive results have similar improvement in general. Knowledge of irrelevant finding make the patient more worsened. It increases focus of minor back symptoms, avoided exercise, and this will lead to more damage. This is a radiation exposure, labeling the patient of having hernia. They are asymptomatic and this is incidental. Sometimes you expose them to hypersensitivity with the contracts, and this lead to subsequently to other unnecessarily invasive, expensive procedure we expose the patient for without need. The concept of vomit, this being the victim of modern imaging technologies. And this has been published in 2003 in the British Medical Journal. As the incidental finding which we have when we requested an imaging, and this lead to other unrelated or other procedure that we requested for the patient to confirm a diagnosis or exclude other problem while it's not there. And this incidentoma is higher in women and higher when the age is more. It's more common with brain CT, brain MRI. Abdominal CT is the highest. And this leads to additional procedure and do not improve the patient well-being, which could harm them more than improving them. This is one, this patient, as you see, it has an arrow, and just to confirm, we'll do other tests. So this is what's happening now. طبعا we need to keep in mind that the cost of requesting imaging is higher, especially the CT. As you said, the cost of CT brain is in a range of 1,000 to 2,000 US dollars. The cost of brain MRI is higher, and the CT deliver 20 to 200 times the radiation than chest X-ray, and this leads to increase in cancer. This has been reported before. The danger of CT, especially the CT of the brain, and the X-ray, which lead to increase of cancers as the patient get exposed to radiation. So, taking home points that when discussing the low back pain imaging, back imaging increases risk of cancer. Imaging abnormalities are extremely common. 90% of asymptomatic over 60 have degenerative or bulging disc. The treatment plan do not change after imaging study. It has been proved by since more than 20 years, all the guidelines, all the associations, American College of Physicians, American College of Family Physician, American Association of Neurology, Occupational and Environmental Medicine, that no need for X-ray or back when we have non-specific low back pain, unless the patient has a red flags. Red flags is very specified, and we need to make sure this is what we need to do in the history while we are taking the history, detailed history, and we after this history and examination, we decide about having the radiology. So another case. Sarah, please let's put the question. A 35 years old man presented to the clinic, reports sinus congestion and headache for 3 days, says he has always received antibiotic for sinus infection in the past. When examination, you find that this is a viral and no need for antibiotics. He starts saying, I cannot wait for things to get worse. نعم.
مو مشكلة جاوبه بالشات لأنه غير موجود السؤال.
أي مو مشكلة. I need to take care of this now. You need an antibiotic and insist for this. What you will do? Do you think that you'll prescribe or no? يحطوا لنا في الشات. شوف بس yes or no. We had it in the chat.
Okay.
B. B. No antibiotic. And this is another way of exposing a patient to unnecessary thing and prescribing a medication that's not needed. So no need for antibiotic. So if we go, and this is يعني صراحة هذا الصورة مرة معبرة إنه diving through the overuse in the practice in general, in the hospitals and also in the primary care. And what's going there inside the top of iceberg, and when you go there, you find more details. What is the value of care? Is there anyone إذا أحد حتى لو يفتح المايك يقول لي what is value of care? Raise hands بس، وإذا أحد يقول لي إيش يعني.
اللي يرفع يده راح أخليه يعني يبدأ. Anyone?
Raise hands. إيش يعني value of care؟
دكتور طارق؟
يا أحد رفع يده؟ ممتاز.
بس دكتور طارق فاتح المايك.
تفضل دكتور. ما أحد حاب يشاركنا؟ طيب value of care in general and how to improve the value of care. Value of care بشكل عام هي quality على cost. As much as we improve the quality and reduce the care, the value of care would be higher. And the quality has many domains that will help improving this. So if we could have a better quality and reduce the cost of unnecessary use, this would lead to high value of care. And this is a new concept now of feminist talking. What are the area of waste ولا overuse in the hospitals? طبعا هذا example من choosing wisely initiative في Washington. They are giving a report that they are this report annually has been done. It has been shown في United States في Washington هذا الريبورت في 2018 that around 47% of the measured services were found to be wasteful, and the individuals they receive low value services in 50% of the cases, and estimated of more than 341 million was spent on low value care. And it has been shown في نفس الريبورت إنه the most common thing in which there is an overuse is as you said is the common treatment prescribed here تقريبا في أكثر من 34%, and screening test that is unnecessarily or diagnostic test that is unnecessarily. Most of the cost of the services is by the hand of the physician. They requesting a labs or radiological thing or prescribing antibiotic which is not needed for patient. This is 10 ranked based on the estimated spend in the United States that showed where is the most area of waste overall, and one of them is مثلا for example lowest vitamin D screening. هذا طبعا has been eliminated من كل الجايد لاينز. يعني تخيلوا بس إنه تعمل فيتامين D screening how much it costs and lead to overall waste of the all the spent في the healthcare system. And we can go further and further and see how much we are prescribing or requesting something which is unnecessary. Are we willing to address the problem? Do you think that there is a problem and we want to, and is it our ethical and professional responsibility to control overuse? These are very important questions we as a physician need to deal with and ask ourselves about them. طبعا الأمريكان it has been shown that the medical profession for new millennium that a physician need to know that while meeting the needs of individual patients, physicians are required to provide healthcare that is based on wise and cost-effective management of limited clinical resources. The physician's professional responsibility for appropriate allocation of the resources required, avoidance of unnecessarily test and procedure. And this is very important that we need to know that we have a limited resources and we need to use it wisely. Unnecessarily services not only expose one's patient to avoidable harm and expense, but also diminish the resources available for others. And there is a lot of examples. يعني مثلا كثير من الأحيان we requested TSH for patient في ER مثلا ويطلبوه البيشنت هو محتاج، بعدين يجيك patient فعلا hypothyroidism you want to follow you cannot find it. omeprazole pantoprazole prescribed commonly، بعدين يجي patient عنده GI bleeding ويجي الطوارئ أو يجي admitted المستشفى they did not يعني لا go out of stock and it has been prescribed بشكل مجيد. طيب الآن أبدأ بالجزء اللي هو خاص بشوزنج وايسلي. حتى أبدأ في هذا الجزء أحتاج أسأل السؤال، إذا ممكن تحطي في البولينج يا have you seen or heard about the choosing wisely campaign before الإعلان هذا؟ yes no. سارة؟
Yes.
سارة في شخبطك في الشاشة، تقدر تشيليها؟
ما أدري، في أحد I think مشخبط دقايق بس. الأغلب no، بس I will share the result.
أنا ماني شايفة الجميع قاعد بيجاوب، يعني عندي 9 بس مجاوبين من 31.
اسمهم no.
have you seen or heard about choosing wisely؟ شوف ما زال في
هذا
إذا توقفيها من فوق أعتقد في طريقة إنك
أوكي كملي دكتورة، بحاول أنا ما أسويها.
إيه أوكي. إذا بس تجاوبوا على السؤال عشان نسمع. it has been shown most لحد الآن 100% nobody heard of choosing wisely. طيب choosing wisely is a global movement to improve health care. It started in the United States in 2012 by the American Board of Internal Medicine Foundation. And since that time, it has been spread everywhere. Choosing wisely started in the United States, then choosing wisely Canada, choosing wisely Switzerland, choosing wisely Brazil, choosing wisely Australia, choosing wisely Japan, choosing wisely United Kingdom, and choosing wisely Finland and Italy. What we started in 2020 is choosing wisely Saudi Arabia. And this has been initiated as an initiation from Ministry of Health with the sponsor of Saudi Patient Safety Center. And the enabler is Ada Health and the MOH to collect and analyze the data related to choosing wisely. What is choosing wisely? Choosing wisely, the concept behind choosing wisely, it helps patients, physician and patient to encourage the conversation about the appropriate use of medical test and procedure. To improve the health outcome, avoid the unnecessarily harm and intervention, and reduce the cost of the services. Choosing wisely is challenging the idea that more is better. We can, what we have, we don't need to use it every time. يعني مو تكون عندي الريسورسز سهلة وقريبة لازم استخدمها. I can request a CT, that means I need to do it, or X-ray. I need to request or prescribe an antibiotic for a patient when it is not needed, even when the patient requests. We can does not always mean we should. And adding more is not always better. And this is a concept. The prime objective of the choosing wisely is to encourage a conversation between health professional and patient. The patient should be informed about the decision taken, and this should depend on the evidence about their treatment or management options. We need to know that do not undergo unnecessarily test, treatment, procedure, or requested to the patient when it's not needed. Choosing wisely is usually a physician-led, because the physician are the one to start the management plan of the patient, either in diagnostic procedure which they are looking for, or the medication which is prescribed, or pharmacological or non-pharmacological, whatever intervention is there, it should be decided by a physician. Patient should be in the center. It's a multidisciplinary approach. It should depend on the evidence and the best practice. And we need to be transparent of this in the choosing wisely. It's a start with having the evidence-based lists, procedures by each specialty, Each specialty in the United States started to eliminate, to identify the most common. They started with 5 most common intervention in the specialty. For example, as a family physician, 5 common ordered or diagnostic order or prescribed medication for the patients, and they find, is it real, going on the evidence, وطلعوا عليها recommendation. They go for all the specialties, and the specialties has listed the evidence-based list and the procedure needed. This is one of the 15 things physician and patient should question, and this is choosing wisely. American Board of Internal Medicine: don't do imaging for low back pain within the first 6 weeks unless the flags are present. This is the recommendation, and 5 questions the physician and patient need to answer related to this. And it spread very wide in the United States. All the societies, the healthcare societies, has the things which physician and patient should question in all specialties: the American Society of Clinical Pathology, the American Society of Internal Medicine, the American Society of Gastroenterology, the America. And here we started this in Saudi Arabia. With the support of the Saudi Commission, we tried to introduce this concept, and we requested all the Saudi societies in the medical field to give us a list of recommendations, their specialty, and we received the recommendation from Saudi Society of Clinical Pharmacy and Saudi Society of Maternity and Child Health, the Saudi Society of Blood Disorder, and they sent the commonest used practice and the recommendation related to it. Why now? Why you think now we need to talk about choosing wisely, and now why we now having this concept? It has been shown, this is internationally, that 5% of the general spend or the test and procedure do not improve the outcome. Physician decision counts for 80% of the healthcare cost, as I said, and 1/3 of the healthcare cost is waste. 30 to 50% of the imaging provided no useful information, and it could lead to harm. And usually the physicians in the field, they say that 73% say the frequency of unnecessary test is a serious problem. 53% order unnecessarily test because the patient insists. 72 says, and this is an international, that average doctor prescribe unnecessary test weekly. 70% says that after they speak with the patient about why a test or procedure is unnecessary, the patient often avoid it. What we did in Saudi Choosing Wisely campaign, we did a survey that involved 600 MOH physicians. Mainly they are in the hospitals, and we asked them about the Choosing Wisely survey, their awareness. 82% they were never heard of Choosing Wisely campaign. 43% they consider unnecessary test and procedure as not a problem. About more than a quarter of the survey repliers, they feel not responsible and are uncomfortable talking to patient about avoiding unnecessarily test and procedure. This is very important point. The physicians, when they had a discussion with the patient, they feel that the patient who's asking more, they try to avoid it. ممكن تقولوا مزعج هذا. طيب, what are the areas of waste or overused in general في healthcare system? طبعا السؤال اللي احنا سألناه للphysicians اللي في practice. It has been shown إنه antibiotic is a real issue, and it has been prescribed for uncomplicated skin abscesses. It was also prescribed for adult and children without uncomplicated sinusitis. It's a viral infection. Also, they order a diagnostic test regularly in the ICU and ER. حاجة غير معقولة. أي مريض يدخل الطوارئ على طول CBC واللابس كلها تنحسب له عينات مرة كثيرة وبعضها unnecessarily. البيز لاين for asymptomatic patient with low risk non-cardiac risk for routine labs. كلمة روتين هذه need to be eliminated، وهذه موجودة more than 50% of the labs is unnecessarily. Unfortunately 52 or they ordered head scan for patient with minor or low risk head injury. Lumbar spine is something which has been used commonly, especially for ER, for more than 40% of the patients. What do you think? What are the barriers or incentives that we think for the physicians? طبعا في السيرفي اللي تعمل في choosing wisely Saudi Arabia, reason for ordering unnecessarily test في 50% of the case تقريبا إنه keeping the patient satisfied. And we want to satisfy the patient, and he requested. And the other thing, we want to feel that we are safe, we are doing a safe practice. Sometimes the guidelines of the hospitals or the protocol which is there it does to do on overuse. زي الإكزامبل اللي أعطيتكم إياه في الأول physiotherapy, they requested an X-ray for the patient before seeing the patient، موجودة في protocol بعض المستشفيات. This is another issue. فالconcept of choosing wisely إنه حتى السيستم need to be supported. Usually this is the thinking of the physicians, and you want to satisfy patient more is better. Defensive medicine satisfy financial ممكن بعض الأحيان incentives في البرايفت بالذات، ولا behavioral feedback establishing a habit. بعض الأحيان يكون السبب lack of confidence, lack of feedback. That's what you used to do. هذا اللي متعودين إحنا نعمله، فعشان كذا نعمله دائما. هذه الطريقة اللي تعلمناها. It is how we've been taught. Desire to impress the supervisor that I did more, so I do it. Inadequate understanding of the evidence which is available. وطبعا هذه من الكونسبت، من الأشياء اللي behavioral things which need to be changed. وبعض الأحيان تكون يعني الآن وإحنا نتكلم عن choosing wisely concept، كثير من اللي معانا في الميديكال فيلد يقول أصعب barrier في الموضوع هذا هو الفيزيشنز. Physicians are very difficult. When they think something or they are expert in something, change is not there. That's why I thought that especially in family practice or family physician, they are a frontliner الآن. They need to have this concept and they need to advocate for this concept. طيب, have you seen or heard about defensive medicine? Yes, no. سارة إذا ممكن تحطي في البون. ما زال عندنا هذا الخبيط. يس في ناس يس عارفين defensive. إيش يعني إذا في أحد من اللي يس يتكلم raise hand يقول لنا. شوفي يا سارة في أحد في الشات رفع يده.
أوكي.
raise hand.
تفضل دكتور.
Assalamu alaikum.
عليكم السلام.
Yes, I'm Dr. Aeshah, Senior Registrar Family Medicine, working in Markaz Sahi Al Malas. So what I understand about defensive medicine, what I have read during my training, that many of the doctors, when they want to make themselves safe or when they want to make a safe practice, so they sometimes overuse some kind of test and some kind of medicines. So at that time, we use the term as defensive medicine. This is my understanding.
Yeah, thank you, Doctora. Yes, I think you're right. طبعا defensive medicine occurs when doctors order test procedure or visits primarily to reduce their exposure to malpractice without depending on the evidence. يعني I'm afraid that I lost something if I had more labs, I had more tests when it's not necessary. Unfortunately, this is very common. في اليونايتد ستيتس has been shown في بعض الولايات بنسلفانيا مثلا عملوا study they reported in 93% of physicians they are using a defensive medicine. فأنا I think in the defensive medicine is to go by guidelines, be updated and go by the guidelines. This will help you. How we can reduce the overuse harm? We need to know that there is strategies to reduce the overuse. Whenever I requested a test, I ask myself, should I order this test? Should I prescribe this treatment? Have I considered the patient? It could be harmful for the patient. Is it? And should I order this test? Help me to make a diagnosis. Result will change the management plan. Is the test important with existing information? Reasonable pretest probability, so it will be useful. The benefit of the test outweigh the risk for the patient. Should I prescribe this antibiotic? هل هو فعلا this treatment have a clinically significant impact on the patient when I compare the absolute risk and number needed to treat? طبعا هذا this is a concept في evidence based medicine. When we treat مثلا number needed to treat, this example for patients to reduce the risk by 25 or 100 patients with absolute risk is 1%, which is better. طبعا نعالج 4 و 25% of them will improve. So we need to know what is the relative risk and how much is it, and this depends on the evidence. Have I considered the patient? We need to empower the patient by encouraging them to ask the correct questions before proceeding to test. ونتقبل, we accept when the patient asks. What are the benefits? What are the risks? Is there any alternative? If I do nothing, what will happen? And this is, and should be the campaign of choosing wisely. It has two sides. One is related to awareness of physician, and the second one is for the patient. And they ask these questions. طبعا additional 5 أسئلة. The fifth one is the cost. And this is another issue, especially when the patient is paying. Have I considered the patient from all aspects, patient value? Is this the best practice that I'm prescribing for or requesting the diagnostic test for? What else can be done? Awareness. We need to, education is an education, and it has been shown that educating and having a peer review between each other, educate each other, go with having a feedback, going with the knowledge transmission between each other, support leading environment. So we have a clinical role model, and teachers will help us to have high value care. And this is one of the concepts which is important, and spread it everywhere. This is one of the examples of choosing wisely. The United States, it has been distributed everywhere, just for the patient and patients when to use or prescribe a chest X-ray. What else can be done? This is an example. This was done here in Saudi Arabia, choosing wisely campaign. In King Khalid General Hospital في حفر الباطن. This is one of the success story which they have. They start implementing choosing wisely. They try to prioritize or develop a list of things that commonly, and this was in the hospital, it's not at the primary care level, which has been requested commonly in their ER, ICU, and inpatient services. Either the antibiotic or labs or CT, and they encourage the patients in this by giving them an awareness to ask the physician. And they found that they collected data, and this data, it showed that there was a high use of the CKMB, which is eliminated. It's Sharman Kull guidelines for diagnosis MI, and it is used in their practice. This was in October 2019. This is a number of the requests which has been done. The percentage of it's related to CKMB in their ER, and by awareness and following up, it has been reduced month by month till they eliminate more than 40% use. The second thing was about the CT scan. It has been commonly used in the emergency medicine, even with minor injuries. They requested the CT brain after the trauma, and just by awareness, it has been reduced to half, and they will add it to system now. I think they eliminated all the waste. The using of Augmentin, requesting or prescribing Augmentin for emergency department for simple sinusitis, which is most of the time viral. It was high, and then it reduced to 50% reduction. This is a 3 months only data. Now it's more. They did a community awareness campaign in which it has been added to the app, which is distributed to the patient and given to the patient in the waiting area, that they ask and not the physician about the medication prescribed, or and they give them an awareness about the harm of some of the diagnostic things. What else can be done? There is the system. If we could change or do a small change in the system, pre and post. This is an example, adding a study which measure number of procedure has been removed at all from the pre-operative orders. It has been removed. And it becomes zero from the system. I know that the National Guard also, they have an experience in which they remove from the list of the routine, from their ordering system, the routine work, they remove it from the ER and ICU, and it has led to much less overuse of the service. To finalize, or to take home message at the end, it's not about prioritizing access to care, but about utilizing the most efficient means to diagnose or treat a disease. Do not provide care with evidence shows is not effective. Decisions are made collaboratively with the patient, and it needs to depend on the evidence. Choosing wisely is to promote conversation between clinician and patient by helping patient to choose care that is supported by evidence, not duplicative, free from harm, truly necessarily and dependent on evidence. We need to give each patient the care that they need, but also consider what they don't need and avoid care that can cause harm. We know that we have different choices and we need to choose one, and this is when it's harming people, we need to take care. It's time for change. It's time to be wise thing when we have a choice. Are we ready to lead the change? And this is very important. We are starting choosing wisely campaign in Saudi Arabia. We want everyone to be part of this campaign. Is there any question, comment, concerns?
Any question for Dr. Aeshah, dear? Please.
في سؤال أنا شايفة. What are the top pitfalls in family medicine practice in Kingdom of Saudi Arabia? And this needs to be studied, but I think that there is an overuse of some, or utilization of some of the routine labs which we don't need. We need to know what's appropriate for the age when we screen the patient, and what's appropriate when we request the labs or radiology, depending on the evidence. And this is not commonly used because sometimes we reply for the patient concern and we do routine things which is not supposed to be. For example, the vitamin D. Commonly, we are requesting a vitamin D, and it has been eliminated from the practice. Patient with back pain, commonly we prescribe an X-ray, which is eliminated from the practice. But what is the top here in Saudi Arabia? This needs to be studied, and I think this is a very important question to be answered.
Okay, thank you, Doctora. Any question more, dear?
Okay, if you don't have any question, thanks so much for listening, and I'm looking forward to have all of you part of Saudi Choosing Wisely campaign, and choose wisely. Thank you.
Thank you all
سارة.
لحضوركم جميعا. See you إن شاء الله soon.
يعطيكم العافية وتصبحون على خير، مساء سعيد للجميع.
السلام عليكم.
عليكم السلام. أهلين. هلا وفاء. Hi, how are you?
Well, alhamdulillah. Thank you so much. Today the session was very interesting and very informative and very important. So we get a lot of benefit, and really there's a dilemma. Actually, sometimes we don't want to request something, but as you said, the most common dilemma, the patient, they are coming and they're asking for vitamin D is very common. Believe me, daily they are coming and they're asking. So we have to prove ourselves on the basis of the risk factors and the sign and the symptoms, and to educate the patient. So to save the financially, the resources and the time consuming even for the patient concerns. So it's really very good, and we try to do that, but it takes time, and we need to change the motivation for the thought of the patient. Thank you so much.
And it needs a lot of awareness. صحيح. This is changing cycle here is it needs time, and we need a lot of awareness at two levels, patients and physicians, and also the system needs to support us to do this. Thank you so much. Thank you, Dr.
جزاك الله خير. الله يعطيك ألف صحة والعافية إن شاء الله.
يعطيك العافية. Thank you, وفاء.
جزيلا.
Thanks for everyone. يعطيكم العافية. سبحانك اللهم وبحمدك. أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك.